Chapter 6, page 179. Reading: Approaches to Psychological Therapy. For a long time, psychoanalysis was the only formalized psychotherapy practiced in Western society. It was this type of therapy that gave rise to the classic picture of a bearded Viennese doctor seated behind a patient who is lying on a couch. Psychoanalysis is based on the theories of Sigmund Freud. According to Freud's views, psychological disturbances are due to anxiety about hidden conflicts in the unconscious parts of one's personality. One job of the psychoanalyst, therefore, is to help make the patients aware of the unconscious impulses, desires, and fears that are causing the anxiety. Psychoanalysts believe that if patients can understand their unconscious motives, they have taken the first step toward gaining control over their behavior and freeing themselves of their problems. Such understanding is called insight. Psychoanalysis is a slow procedure. It may take years of 50-minute sessions before the patient is able to make fundamental changes in his life. Throughout this time, the analyst assists her patient in a complete examination of the unconscious motives behind his behavior. This task begins with the analyst telling the patient to relax and talk about everything that comes into his mind. This method is called free association. As the patient lies on the couch, he may describe his dreams, discuss private thoughts, or recall long-forgotten experiences. The psychoanalyst often says nothing for long periods of time. The psychoanalyst also occasionally makes remarks or asks questions that guide the patient, or she may suggest an unconscious motive or factor that explains something the patient has been talking about. But most of the work is done by the patient himself. Psychoanalysis has sometimes been criticized for being all talk and no action. In behavior therapy, there is much more emphasis on action. Rather than spending a large amount of time going into the patient's past history or the details of his or her dreams, the behavior therapist concentrates on finding out what is specifically wrong with the patient's current life and takes steps to change it. The idea behind behavior therapy is that a disturbed person is one who has learned to behave in the wrong way. The therapist's job, therefore, is to re-educate the patient. The reasons for the patient's undesirable behavior are not important. What is important is to change the behavior. To bring about such changes, the therapist uses certain conditioning techniques first discovered in animal laboratories. One technique used by behavior therapists is systematic desensitization. This method is used to overcome irrational fears and anxieties the patient has learned. Smith, 1990. The goal of desensitization therapy is to encourage people to imagine the feared situation while relaxing. For example, suppose a student is terrified of speaking in front of large groups, that in fact, her fear makes her unable to speak when called on in class. How would desensitization therapy change this person's behavior? The therapist might have the student make a list of all the aspects of talking to others that she finds frightening. Perhaps the most frightening aspect is actually standing before an audience, and the least frightening is speaking to a single other person. The client lists her fears, from the most frightening on down. Then the therapist begins teaching the patient to relax. The client tries to imagine as clearly as possible the least disturbing scene on her list. As she thinks about speaking to a single stranger, the student may feel a mild anxiety. But because the therapist has taught her how to relax, the patient learns to think about the experience without being afraid. The therapist attempts to replace anxiety with its opposite, relaxation. The procedure is followed step by step through the list of anxiety-arousing events. In the forms of therapy described thus far, the troubled person is usually alone with the therapist. In group therapy, however, he is in the company of others. There are several advantages to this situation. Group therapy gives the troubled person practical experience with one of his biggest problems, getting along with other people. A person in group therapy also has a chance to see how other people are struggling with problems similar to his own, and he discovers what other people think of him. He, in turn, can express what he thinks of them, and in this exchange, he discovers where he is mistaken in his views of himself and of other people, and where he is correct. Drum, 1990. Another advantage to group therapy is the fact that one therapist can help a large number of people. Most group therapy sessions are led by a trained therapist who makes suggestions, clarifies points, and keeps activities from getting out of control. In this way, her training and experience are used to help as many as 20 people at once, although 8 to 10 is a more comfortable number. Therapists often suggest, after talking to a patient, that the entire family should work at group therapy. This method is particularly useful because the members of the group are all people of great importance in one another's lives. In family therapy, it is possible to work on the complicated relationships that have led one or more members in the family to experience emotional suffering. An increasing number of self-help groups have emerged in recent years. These voluntary groups, composed of people who share a particular problem, are often conducted without a professional therapist. During regularly scheduled meetings, members of the group come together to discuss their difficulties and to provide support and possible solutions. Self-help groups have been formed to deal with problems ranging from alcoholism, overeating, and drug addiction to child abuse, widowhood, single parenting, adjusting to cancer, and gambling. The best-known self-help group is Alcoholics Anonymous, AA, which was founded in 1935. Far more people find treatment for their drinking problems through AA than in psychotherapy or treatment centers. The various talking and learning therapies described so far have been aimed primarily at patients who are still generally capable of functioning within society. But what of those people who are not capable of clear thinking, or who are dangerous to themselves or others? Antipsychotic drugs are used in the treatment of schizophrenia. The most popular of these medicines have been the phenothiazines, including thorazine and stelazine. Patients with schizophrenia who take these medications improve in a number of ways. They become less withdrawn, become less confused, have fewer auditory hallucinations, and are less irritable. Although the patient who takes antipsychotic drugs is often improved enough to leave the hospital, he or she may have trouble adjusting to the outside world. Many patients now face the revolving door syndrome of going to a mental hospital, being released, returning to the hospital, being released again, and so on. Phenothiazines also have a number of unpleasant side effects, including a dry mouth, blurred vision, sleepiness, and muscle disorders. Another class of drugs, called antidepressants, relieve depression. Interestingly, they do not affect the mood of non-depressed people. It is almost as if these medicines supply a chemical that some depressed people don't naturally have. Some of the antidepressants have severe side effects.
End of CD2.